wrinkles, linear atrophy can happen around the ما اشتغل هاي بس الكاميرا اي اوكي تمام okay. So this category of the old age, usually there is needing of the contour volumization plus correction of the linear atrophy surrounding the lips due to the action of the orbicularis oris muscle. This is the how lip in the profile should look like, because we might have in front of the 2D good lip correction, but whenever they are walking like that in the profile, you'll see that duck's lip. So the line which is drawn from the tip of the nose to the chin, the tips of the lips should extend out of that. Otherwise, of course, it will be something that not corresponding to the natural lips. The golden ratio, we talked about it. The upper lip, usually it is, we don't have, you know that the Africans, they don't correspond to these proportions. But as general concept of the beauty, the golden ratio is like that. 1/3 of the volume is for the upper lip and the 2/3 is for the lower lip. The correction of the contour, usually the lip, actually later, if we had the correction of the lip, usually in the classic injection, of course, for the contour, we should divide the side of the lip to 3/3, 1/3 here, 1/3 here, and 1/3 here. And starting from medially to the distally, to inject just in the order. Not too much superficial, but not deep. It should be deep, otherwise it will migrate upward. So injection to this area, but in each injection we should go to the other side at the same time to inject the same amount by the same direction and same force, so that we keep a symmetry. The most important thing in the beauty is the symmetry of the results. The middle part is usually, in the case of the contour, it's not too much concentration or too much attention to the Q point. I mean in the case of the natural lip. The upper lip, usually it needs 0.3 to 0.5. Actually, it's roughly talking about that. If you have one filler, 0.4 it's for the upper lip and 0.6 for the lower lip. The same procedure, just going over the vermilion border to inject bilaterally, just injecting one side and going to the other side at the same time. Volume is the second thing that we talked about, that usually in case of the very young that need only volumization, but the volume, usually the lips should not exceed 1 cc. It should not exceed 1 cc, because the volume, roughly the mean of the volume of the lips, it is 1 cc in the whole community. And this is done through the multiple micro droplet. You know that we have the linear injection, and the microbolus injection. So in the body of within the body of the lips, at the center of the vermilion. Vermilion is the part of the transitional part of the lips from the skin to the mucous membranes, but not too much reaching to the lower part, because lower part of the vermilion, it is dangerous regarding the side effects. Be careful not too much injecting to the lower part of that, making the punctures within the needle, the medium or the middle of this part, and making multiple injections. And usually for lower lip, it just to make two partitions, one in the right and one the left. There is no need to make 3/3. The same procedure. Here the upper lip, it needs about 0.3 to 0.5, and the lower at the same time, the same thing like the contour for the lower lip. And this is about the theoretical part of these of the natural lips. طبعا إذا كان عندنا هيك بس هنا مو موجود، اكو هذا نرسم عليه، فد شيء نرسم عليه ما اعرف شنو. اوكي خلينا نجيب الفولونتير. اذا عندكم اي اسئله او استفسار او مثلا recommendation. nope. okay. طبعا the best احسن طريقه you should secure the pain of the patient, of course. Without securing the pain, it is difficult to work on the lips because they are very sensitive. And the right of the patient to secure his pain, to be comfortable, the best way is to inject intraorally to block the lips, not to put the creams of anesthesia, because we decided not to volumize too much the lips. So with the putting the creams of the anesthesia, the lip itself, it will become larger than its real size. So we'll not be able to assess our result, our work. This is very important. It's intraorally to the vestibule, just injecting upward and laterally, and the same way to the other side, and lower lip also the same thing to the depth of the vestibule. It means that the part that both the mucous membrane the convexity of the mucous membrane here. So we'll inject there to reach the infraorbital and mental nerve. But that way we will secure the pain of the patient, and على راحتنا راح نشتغل عليه. وهاي هي.
Between which tooth we will inject our needle? Or infraorbital blockage. I have a space between my tooth that I should.
I don't want to enter the exact the details of the. It is between the first molar and the second, but the most important thing that just to inject to the maximum convexity of the vestibule, it will be the correct site for the injection. اتفضلي حضرتك. ادي اللي كنتو داني قاريتي داني. هسه تقدر تحول الكاميرا على the duration to remain, but the much larger the cross linkage, the G prime will be harder, the gel will be very hard, and the lips will not look naturally during speaking or during movements. So for how long? Usually we expect that from 4 to 6 months it will remain. The problem of the re-injection is not a problem. Usually there is no, it's not like a Botox to afraid from the producing the sensitivity or antibodies toward the Botox not to work. Yes, doctor. Regarding the guidelines of the injection, it is the range It is the range. I said that this is it's the same, 0.3 to 0.5. Yes.
Volume loss with the aging.
Yes.
Is equal between the upper and the lower?
Of course. The same. The same. So that I said roughly, if you want to divide your 0.4 for the upper lip, 0.6 for the lower lip. Because everywhere that we want to fill it, we should know the expected volume that this area has. For example, if you are, talking about the glabella. Glabella, we don't expect that it is more than 0.5 cc, so it is not recommended to put more than 0.5. Otherwise, it will go there and to the right and left and making the asymmetry. Majority of the asymmetry, it is due to the overcorrection because it is very delicate. Yes.
We have to be strict to optimizing this correlation, golden ratio.
Yes, exactly. This is we should advocate for it. I'm advocating for this natural lip actually. Otherwise, the trend still it is in our country is going with the TP or the Russian lip or the now it's called the other also it's a Sweden method. It is the same. The prototypes of the Russian lips. That's very big lips. This is not healthy, but it's a trend. Now. عندنا زايلوكاين
انجكشن يعني
ايه ماكو والله ما احتاج هوايه
يعني نقدر
ندبر بالنسبه our client شنو عندك شنو اللي عندك
بس شيء قليل نحاول.
بس احنا جايين على الشفايف مو على والله اكو نقدر female will be absolutely correct regarding the lips. In this case actually the ايش قد عمرك؟ 36. She's lying in both the volume loose. Actually, if you are nearby, the contour it's quite okay. But at the same time, we can do both contour and volumization for this case to inject in the vermilion and to the body of the lips. So now, what we want, we should divide the lip to 3/3 in each side. The middle third, medial third, and the lateral third toward the commissures, and to inject in both sides at the same time. But I'm waiting for the lidocaine. أنت مخلي كريم؟ لا؟
حضر لك دكتور نيدل اور كانيولا؟
والله لا نيدل
نيدل
بس خليه يجيب هذا شنو؟ العفو بس شوية. You know that the most important thing we as a doctor in our offices is keeping all the obligations of the infection control. We are doing injection, but it is not for long period. It means that we are in the semi-critical setting that we should wear actually not these gloves. We should wear at least, not at least, it should be in the pouch sterile gloves and disinfect the lips or the area where we are going to inject. Majority of the side effects are due to that. This is زايلوكان يا؟ زايلوك. قبل انت مسويه؟
اي بس دكتور مو وايد تخدير
اوكي مو مشكله. لا قصدي انت رايحه طبيب الاسنان؟ ايه اوكي ضاربه على مود. بس واحد يركز على الكاميرا ما اعرف ايش ذا. شوي رفع راسك. طبعا هذا لازم يكون على السديه، بس السديه مالتنا لازم تكون 45 يعني مو هاي. حتى نسوي هذه بسم الله. طبعا catching the area and looking at the tip of the vestibule and on the between the second or over the second molar, of course we will inject just somewhat inclination to the lateral part so that our target will be toward the infraorbital fossa. Okay, the same thing, we will repeat the procedure here. This for the lower lip, the same. We will just revert and forward to see the vertex of the or the apex of the vestibule and injecting toward usually 0.5 to 1 cc. Of course, yes, the xylocaine. If it is not in carpools, if it is one carpool, just divide by 4 and inject. One carpool is enough. I recommend usually using the carpools which the dentists are using because it is more securing the pain. By this method we can say that 80 to 90% we secure the pain. هسه شلون؟
بس هذا بعد.
هاي بعد. طيب ما يصير، احنا لازم نقعد نقعد على السدية. لو تجيبون سدية هنا، لو نروح هناك. Just asking the patient, asking the client about the effect of the xylocaine started or not. بليد. شنو المشكلة؟ الشق هذه؟ الشق شوفي، احنا هسه نسوي لك هذا، بعدين ما تروحين راح اصحح لك هذه، زين؟ لانه هسه احنا مو حاكين على الموضوع.
في بين بعدين.
اوه لا ما تخافي. بلى. شو؟ ها؟ ايه؟ أو دي بريمولر. وقتي ويا راس لسدوا مية ودكي. مو مشكلة، يعني تريدين نفس الشيء. تفضلي على السدية.
شلونك دكتور؟
اهلا وسهلا، شلونك انت؟
الله يسلمك.
تسلموا.
دكتور الاسبتيك كونديشن تبكي.
السبتيك ايه السبتيك كونديشن
تبكي في الزاوية.
اوكي. وهذه الكاميرا، اهم شيء كاميرا. تعال هنا، انت تعال هنا. تمام. ايش قد ما تكون حريصين على الانفكشن كنترول احسن، لانه اكثرية المرات هو side effects are due to the failure of the infection control. عفوا دكتور. انتم ما عندكم قلم مو؟
ماركر؟
هلو ماركر مو جايبينها.
يعني
اوكي. speak about. انت تصور داري شو؟ بس باو على. لا والله ليش ما كنت هناك؟
هو قال لي راح يشتغل الدكتور منه.
ها؟
راح تكون منها دكتور؟
اوكي تمام. Roughly about the 3/3 we can say that measure the scale will be this, the head of this the needle. Well, this is 1/3, and this is the another middle third, and this is the usually the lips correspond to the 2/3 by the length of this the usual filler injection needle. So start. صوت جيد. صوتي زين. هو صوت بيدي بس الإنارة وأنا مو منور. Okay, so always scaling actually it's not like that working, but because of you I'm demonstrating, otherwise it's not like that to work. We should take the best comfortable position for us from here, but I will do like that because of you, just to see the demonstration. So this is the 1/3. We'll scale like that and come back just to inject to the make a puncture. Of course, we cannot say that we 100% secure the pain. There will be, but just look at the vermilion border. Go within the vermilion border. It is, how do you know that you are in the vermilion border? That there is a resistance. The tissues are not like that of the. No. بس دقيقة. عادي. We will go through this and just to reach the cupid and to inject. We'll see. I think I don't know whether it is clear for you or not, but the first puncture. At the same time, just because of so that our hand will not forget the memory of the type of the injection and the volume that we injected there, we'll go to the other side. The problem that's just injecting, making simple puncture, not too much deep, and going through the vermilion border till we can reach the top of the, and we can see that we are within the vermilion border, and injecting retrogradely. This is the regarding the and coming to the other side, the same. As we said, just not to forget the amount and the force and the direction, that to keep the symmetry. This is the most important. We should not disturb the symmetry of both sides. The same thing from the commissure and simple puncture and going through the vermilion border. And the same, now injecting from here. مبينة بالكاميرا ايه تمام. Now from the middle please, يعني من الوسط. at least if you can assess, however, the illumination is not very good, but the symmetry kept, we need to inject for the volume also. Now, in the middle of the multi-punctures. Volumization, of course. The filler should not be laid too much deep, but not too much superficial, of course, because it will be عافيتي شو هاي عنده تشققات وهاي شغلات. The same thing for the lower lip. For the lower lip, usually we have only the two half, one and two. We will just inject to the middle half of the each side. شوية صعب على الكاميرا، بس لازم أني هم أركز على شغلي. So this is طبق على our client. She has, apart from that, lot of other problems. It is look like the semi-hair lips. Some fissures actually not a good candidate for the demonstration. انطيني جوز. لا هو مبلل. The modulation of the filler is very important. I don't name it the massage, because massage is something that very let us to say too much force. Just modulation of the what you put there, it is enough. Now we have this lip that would be natural. However, I put too much in the upper lip because she had something like the hair lips, the cleft lips in here, the defects in the upper lip. So I put more than what is needed actually. Tema? Any question? Any comments?
Lower lip.
Yeah.
You mentioned you are only injected from 2 points, one on the left and the other is on the right side.
Yes.
Right?
Yes, exactly.
For the upper it's 3 to 3.
No, we will divide for the contour of the lower lip. We'll divide to two half each side, one and the second. Just inject to the middle one, from right and the left. So 0.3 here will be 0.6, and the upper will be.
For the lower lip, do you reach to the middle of the lip?
No. Just for volumization, we can touch the body of the lip. For contour only. Yes.
Now the upper lip looks like more larger than
larger because she has. Actually, we should have the photograph of a previous. She had lot of fissures like that in the like the hair lip, cleft lip. So from the first, it was not a good candidate for demonstration. We should have a normal lip, so that we put at the end too much volume there, just for correction of that. Any injection you are puncturing and there will be bleeding and more volumization of the area. But there will be this increase in the size will be subsided within 24 hours or less than 2 days.
Patient to more than 2 ml filler for filler for lip. Is that
Basically, from the vermilion border downward, we are doing Russian lip or the tippy or the what's called the Paris, the lips. These we are not talking about that because you know that every injection is injection. By the end of the day, all of these they are correct. But the method of the natural lip, it is like that. It's said that perpendicular, if you are perpendicularly putting the fillers, less possibility of injuring. Maybe you will injure only one blood vessel. But if you are going just like that, very superficially, you will end up maybe with the problems. And in majority of the time, bruising will be very possible in these situations. We have a second candidate, I think. Where is the cameraman? زحمة نبي بلا زحمة وين منو الكاميرا بلي
this injection
بعد دي باقي
you inject from here to here from here to here
لا والله دكتور هيك شيء من هيك شيء اسوي سكيلينج اعرف انه اني
تحديد
ايه
بس بعدين سويت
بعدين لا لا هيك شيء بيربنديكولار يعني هيك شيء عمودي.
يعني انت اول مره سويت التحديد
بلي
بعدين دخلت هيك
لا
ما دخلت
لا هو تكنيك مال هذا لا وموجود. يمكن هيك نروح من يعني خلينا نقول هذا النص هنا مو نفوت من هنا وحتى نوصل هنا ونسوي فد كالباس لايك كالباس لايك or the sausage like injection here
from the middle
بالضبط deeper of course ونفس الشيء هنا بس الطريقة هذه الناتشرال يحكي غير شيء. وبالاخير كل واحد مثلا يضرب حسب بالاخير هو يسوي التكنيك مالته. بلي انا عراقي
وانا عبالي هندي
ليش على شعري يجي
اكو وحده she wants to abolish this
كيوبت هذا
I don't know why so how can we
it is like that دكتورة vertical مثل ما الدكتور مؤيد حكى من هنا شوية maybe 1 millimeter over the vermilion border وتروحين كلش superficial رأسا وهيك روتروجريد حتى ترفعي بس أول شيء بالنص. مو احنا هسه نسوي ادفوكيسي ضد هالطريق.
انا ادري انا قلت له ما حلو بابا هو احلى شيء هذه شو اسمك دكتور؟
ديندار
اسمك مال هنود
لا هو اسم كردي مو احنا هنود اقارب. اهلا وسهلا بحضرتك.
دكتورة انوار
اهلا وسهلا دكتورة اهلا وسهلا. هاي هواي زرت بغداد واشتركت بالمؤتمرات بس يمكن ما صادفتني. اي اكو يمكن مو
اي
كمان عندي